everyone, our presentation today is on alcohol use disorder, and alcohol is the most abused substance globally. So what is alcohol? It is a psychoactive and toxic substance that is produced from natural fermentation of sugars and contains properties that are highly addictive. Now, what is alcohol use disorder? It is the excessive use of alcohol that leads to severe mental and physical problems. It is a chronic brain disorder that impairs the ability to stop using alcohol even after having adverse effects. Globally, around 2 billion people consume alcohol. Here in Kenya, ages between 15 to 65 has the number of most people who consume alcohol. Around 23% of students have at some point used alcohol. Gender-wise, more males consume more alcohol than the females. Disturbing statistics show that around 23% of students have at some point consumed alcohol, which is more rampant in higher education levels like universities. Age-wise, more young people consume alcohol than the adults.
Alcohol use disorder presents with variety of effects ranging from short-term effects to long-term effects. Under short-term effect, someone with alcohol use disorder presents with drowsiness, they may present with vomiting, stomach upset, headache, impaired judgment, breathing difficulties, and unconsciousness.
DSM-5 classification, which is the Diagnostic Statistical Manual of Mental Disorders. Now we are currently using the DSM-5 by the American Psychiatric Association. This DSM-5 literally removed all these words that were previously used: alcoholism, alcohol abuse, and alcohol dependence. So currently what you're saying is alcohol use disorder. Now alcohol use disorder is a chronic relapsing brain disorder that is characterized by somebody having the inability to control the alcohol intake, despite having the effect on their health, that you've been told by the doctor you have a problem with your liver, but somebody is still continuing drinking. Somebody has also been told it has affected their social well-being, in terms of it has affected their marriage, it has affected their relationship with their friends or family, but somebody continues drinking. It has also affected their occupation. This is a lawyer, this is a professor, a doctor who's supposed to be able to work, but it has affected their profession, but they continue drinking despite this. Alcohol use disorder is classified into three. There's mild, there's moderate, and there's severe alcohol use disorder. In mild alcohol use disorder, one has 2 out of the 11 symptoms, or 2 to 3 symptoms out of the 11 symptoms. In moderate, somebody has 4 to 5 symptoms out of the 11. And in severe, somebody has 6 or more symptoms out of these symptoms seen in alcohol use disorder.
So in the treatment for alcohol use disorder, we use, one of the tools that we use is the 12 Steps of Alcoholics Anonymous, which is a long-lasting treatment for people in sobriety, and it was founded by Bob Wilson and also Dr. Smith, and it has the 12 Steps of Alcoholics Anonymous and the 12 traditions. So the 12 Steps of Alcoholics Anonymous, the first one is that we admitted that we were powerless and over alcohol and that our lives had become unmanageable. And then the second one is that we came to understand that there was a power greater than ourselves that would restore us back to sanity. The third one is we made a decision to turn our lives and our lives unto the care of God as we understood Him. The fourth one is we made a searching moral inventory.
When patients present with alcohol overdose, they have a history of consuming a lot of alcohol in a very short duration, so they pass out. Like they basically present to us in a subconscious state or in an unconscious state. So the first thing we do is we have to check the sugar levels, and we also have to check their dehydration levels. So first management, we always give them fluids so that we can restore their body fluids, because they are sometimes dehydrated. Most of them have got breathing problems, so we end up giving them oxygen supplements. And the third one, when they've stabilized, we always give them nutrients like thiamine so that we can build their liver, we can restore their liver. And last one is we use drugs to prevent seizures and convulsions because of the alcohol, because alcohol affects the brain. So we give them anticonvulsants so that we can stabilize them.